Good afternoon and welcome to the Assembly Health and Human Services Committee. I almost said morning, y'all. I almost said morning. Would the secretary please call the roll?
Assemblywoman Gonzalez. Assemblywoman Gorlow. Assemblyman Gray. Assemblyman Hafen. Assemblyman Hibbets. Assemblyman Koenig. Assemblywoman Newby. Assemblyman Wynn. Assemblyman Orenlicker. Assemblywoman Taylor. Assemblywoman Thomas. Chair Peters.
And I am here. Please mark those who are absent at the moment as here when they arrive. We will go ahead and start with some housekeeping items. As always, please ensure that your devices are muted and don't be like me this morning and interrupt everybody while they're speaking. We have various ways to testify, all of which are listed on the agenda, which include in person, by phone, and by mail and fax. You may also submit public comment in writing, either in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or up to 24 hours after the meeting's adjournment. If you wish to testify in person, please sign in at the table by the door and leave a card for your record of your name. If you do not testify, you may also want to sign in so that there's a record of who's interested in these bills in the event that we'd like to contact you later. To ensure an orderly flow of discussion, I ask that all comments, questions, and responses go through me, and committee members must be recognized by me before you can speak. Additionally, I ask our presenters on Zoom video call to leave your cameras off and microphones muted until it is your turn to present or if I direct any questions to you. When testifying in person, please turn the microphone on to speak and off to listen, so that we don't get that nasty reverb and have a clean recording of the meeting. And with that, we'll move on to our agenda. We have two agenda items today. The first is a bill hearing, Senate Bill 172, presented today by Senator Harris. Thank you so much for being here, and then public comment at the end. I will go ahead and open the hearing on Senate Bill 172 and welcome Senator Harris. Thank you so much for being here. Before we move into the presentation for testimony, I want to set a couple of expectations. I will be doing a 3-minute max per person so that we can ensure everyone has the opportunity to speak today. Several folks have plane flights they're trying to get to this afternoon. I want to make sure that we don't run into people having to stay overnight if we can get out of here on time. And we will do a total of 30 minutes in support, 30 minutes in opposition, and 30 minutes in neutral. And I will try and stick to those today, so please be conscientious of those who are also testifying in those areas. Okay, with that being said, we will move on to the bill hearing. Welcome, Senator. Thank you so much for being here. Please remember to state your name for the record. You may begin when you're ready.
Good afternoon. Thank you so much, Chair Peters and members of the Assembly Health and Human Services Committee. My name is Dallas Harris. I represent District 11 in the southwest part of Clark County. It's my pleasure to be with you all today to present Senate Bill 172. I'm pretty sure you haven't gotten any emails about this bill, so let me just walk you through it. Senate Bill 172 amends NRS 129.060, and it ensures that a minor can give express consent for preventative services. Prior to this bill, current state of the law, a minor can give consent to be examined and or treated for an STD if they are found to have one. But if they want to get access to the types of services that will prevent them from getting the STD in the first place, that's a no-go. Let me take y'all way back into the time machine when this statute was first put in place. I believe it was 1972, sometime in the 70s. And I was astonished to find that the original version of this bill, of this provision, did not even require the minor's consent for the treatment. They just said, we're going to treat them. Now, obviously, that's not the way to go, and we've evolved over time, and we made sure that the minor, at least, had to give consent. But the truth is, in the United States, we have an STD problem amongst our youth. Half of the nation's STIs are in people ages 15 to 24, half. Here in Nevada, based on a Nevada Youth Risk Behavior Survey conducted in 2019, it found that 33% of high school student respondents reported having sexual intercourse. And if any of y'all went to high school, like I did, that number might seem a little low. 23.1 were currently sexually active. Of those that have had sexual intercourse, 44.1% reported no condom use during their last sexual intercourse. 54.9% of females reported condoms were not used the last time they had sexual intercourse. And of males and females respondents who reported being sexually active, 89.75 reported no condom or birth control use during the last sexual intercourse. Those numbers should freak y'all out. They freak me out. Nevada is at the top of a lot of the wrong lists. And that includes chlamydia, syphilis, and all kinds of other STDs. We've got to do something. And this is not the only thing that I suggest we do. If I can get it out of finance, I've got a very large bill, Senate Bill 439, that is also designed to ensure that we are taking a very large look at our state's sexual health. Last session, we passed a bill that came through this committee as well that would ensure that primary care doctors are regularly asking people if they would like to be STD treated. It is my hope, tested. It is my hope that all of these things together can address what is a very real problem. And I said this on the Senate side, I'll say it here. If there are minors listening, talk to your parents. But if any of you all on the committee have children, you know they don't always do that. And if they have the foresight enough to say, I'm likely to engage in sexual behavior and I want to make sure that I do so safely, that I don't end up getting an STD, we need to make sure the barriers to that type of healthcare are as low as possible. This isn't a knock on parents. You could be the best parent in the world. Doesn't mean your kid wants to talk to you about sex. It's not about you, it's about them. And we want to make sure that here in Nevada, we're not just working on the back end and allowing you to go and get treated once you already have the STD. We need to be smart and make sure that children have access to the type of things that can prevent them from having what are sometimes lifelong illnesses in the first place. And with that, Madam Chair, I am more than happy to answer any of the questions that the committee has.
Thank you for the presentation. And there are several bills coming through the session talking about sexual health and the really epidemic that we have in the state of Nevada. I know when I was pregnant, the first thing that my physician did was do an STI check, because the impact of an STI is not limited to yourself in a lot of cases. It can even affect those around, well, it definitely affects those around you, but can affect those who were not a party to the actions resulting in the STI as well. I also wanted to take a personal privilege, I suppose, to share my story with the conversation of sexual education and health. In my family, we've always been very open about the conversation. I come from a family of doctors, but on my dad's side, not so much. And my aunt, I was 4 years older than her daughter. My aunt came to me when I was about 17 and said, I cannot have this conversation with my own daughter. Can you do it for me? And so at 17, I had the conversation with my 13-year-old cousin about, here are the resources around you to go find help if you need information on your reproductive health, and even had the conversation with her about how to manage your menstrual cycle. So it's not about parents being good or not. It is really just about where can you find and access information, and what better place than the physicians who have accurate information. That being said, I will open up for questions. Please let me know if you have any. I have a few on my list, and we'll start with Assemblywoman Gonzalez.
Thank you so much, Madam Chair, and thank you so much, Senator Harris, for this very critical and important bill. I think that the number and statistics of sexually transmitted diseases and sexually transmitted infections, for those of us that didn't know what STIs are, it is frightening, and it should scare everyone, right? Just from my own experience, right, like teenagers are going to do this. And so we need to make sure that they're protected and have the correct resources. And so I was curious, I don't think I saw anything in this bill. And I know that there are a number of different bills, but I was curious if you would be open, or kind of like what it would look like if we could provide maybe a one-pager to these youth about places that they can get sexually accurate education in the event that maybe those other pieces of legislation doesn't go through right away.
Thank you for the question, Assemblywoman Gonzalez, to you through Chair Peters.
Please feel free to go directly.
Thank you so much. Dallas Harris for the record. I am a fan of more information is always good. I think we'd have to have some discussions about how that information is disseminated, where it's disseminated, and what form that might take. But I know that there are lots of nonprofit providers and partners who can kind of take on that mantle. I think it's a great idea.
Thank you for the question. I have Assemblyman Gray next.
Thank you, Madam Chair, and I apologize for being late. Still trying to figure out how to formulate this question, so I'll start off with kind of more of a statement. I agree with you. The kids don't want to have the chat with the parents, but we have to remember they're kids. It's the parents' responsibility to have the chat, and if there was a way to legislate parents had this chat, that would be, I think, the way to go. Coming from a medical background, though, kids don't understand informed consent. They don't understand any of that, so I just don't, I cannot get on board with them being able to give consent when they don't understand what they're really consenting to. So I guess how can you get around the parent and feel safe about it, I guess. And I just don't think the parent should be gotten around. I mean, that is their child. If they're engaging in what is not dangerous behavior anymore, but if they've engaged in dangerous behavior and gotten hurt, why shouldn't the parent know?
Thank you for the question, Assemblyman Gray. Dallas Harris for the record. Just to level set, right now today, a child can get treatment for an STD, including medication, right? And the issue really is not about how much parents can be involved. I want them involved. There's nothing that says the parent can't be involved, okay? Children, talk to your parents. When you have big life decisions, parents, have the sex talk with your kids as long as it's healthy, right? I am 100% for that. This bill does not preclude that. However, we all know children aren't always comfortable having that conversation. We also know that if they do not have that conversation, and that if they do not have access to these preventative services, that they're going to have sex anyway. So then the question becomes, as a public health decision, what do we do as a state, right? And there's just no world in which a child can't access this type of resource and says, so I'm not going to engage in the sexual behavior. If they're going to do it, how do we ensure that they are doing it in the manner as safe as possible? That's what this is about, Assemblyman.
Quick follow-on.
Okay.
Again, though, they're children. I mean, they shouldn't be having sex. I mean, regardless as if they're going to, little boys are going to play with matches. If they get burned once or twice and mom and dad catch them once or twice, they're going to, it's over and done. And, like Assemblyman Peters said, when her aunt came to her, I mean, at least her aunt was smart enough to say, okay, I can't have this conversation with my kid, but I know somebody smart enough and intelligent enough to have that conversation. Again, it goes back to being the parent's responsibility. And I don't know. When I was in high school, I mean, they scared the crap out of us. And I don't think they meant to, but I mean, they showed the pictures. They said what the ramifications are. They talked about tertiary syphilis. They talked about all of these things and the consequences. And, it, like I said, it scared the heck out of most of us in the class. So maybe if we went back to that kind of an education, not showing how to, put the condoms on, I'll be, crass. I mean, those are the kind of things they're focusing on today. They're not focusing on what not to do. They're focusing on, well, you're going to do it anyway, let's do it this way. And I think that steers us down a very dangerous road.
Thank you for that comment, Assemblyman Gray. Dallas Harris for the record. And if you want to bring a bill to raise the age of consent, we can talk about that, right? But that's not what this bill is. And I will mention this body, as well as Health and Human Services on the Senate side, has considered legislation that would make sex ed much more robust. And so those options are also out there. Again, this is not meant to be an only fix, right? And it's not meant to give free rein. No child, if this bill is passed, is going to engage in intercourse that they weren't going to engage in anyway. I don't think that's quite how high school or college works. But I do firmly believe, and I believe the statistics show, that if your parent says no, that doesn't mean the behavior is not going to follow. And so in this imperfect world that we live in, what choices do we make? From my studies, based upon the HIV Modernization Task Force, that's where this bill came out of over the interim. This is the direction that we need to move to keep our children as safe as we can, and to try and head off what is really a very large STI problem in our community.
Thank you for that. And I wish we had public and behavioral health in the room, because the statistics are staggering, and the number of children born with congenital syphilis in this state is it's truly a reflection on how poor our public health and sex health policy has been in the state of Nevada.
And Chair Peters, if I may, Dallas Harris for the record, I believe we are number 2 in the country for congenital syphilis rates. So way to go.
Probably Florida. I'm just kidding. Okay, we're going to move on to Assemblywoman Thomas, please.
Good afternoon. Thank you, Madam Chair. And thank you, Senator, for this much-needed discussion. And with this bill, we keep referring to families, but there's one group that we keep missing in this conversation. We have a lot of homeless children out there. And we have a lot of children that don't have parents, and they may be in foster homes, and where they will not get that education from a responsible adult. So I appreciate you bringing this bill forward, and sometimes we need to poke the bear. So thank you.
Thank you so much, Assemblywoman Thomas. Dallas Harris for the record. There are many variations of family life for all types of youth in this country and in this state. It does not always look like a mom and a dad, or two moms or two dads, or it could be a grandfather and a mom who are teaming up to take care of children. The child could be homeless. I mean, there are many variations. There are lots of people who may not come to mind immediately, but we do also need to legislate for them. So thank you for that.
Yeah, thank you for bringing that up. I was also thinking about our foster kiddos and what opportunities those folks have in our public health arena. And we will move on to the next question from Assemblyman Hafen.
Thank you, Madam Chair. And it's good to see you, Senator. I know we've had a lot of conversations about condom use or lack thereof and STI, those I and D. I want to dive into the bill language, short bill, 3 sections, and because I think some people are getting confused of what we're doing. We're not changing minor consent. Minor consent is already in law. A minor can already go get these services at the local or state health officer. We're just kind of now expanding the facilities that they can now go to, correct?
Thank you for the question, Assemblyman Hafen, and it's okay to see you. They are so you are right when it comes to one part of the bill, and that is Section 2. When it comes to Section 1, we are expanding minors' ability to consent not just to examination and treatment, but now to prevention. Does that answer your question, sir?
Yeah, and kind of my follow-up is currently my understanding is it Title 9 facilities, which is basic 10, Title 10, thank you. Facilities are the ones that currently they can go get the treatment, and I apologize for missing that part, which are your Planned Parenthoods, and you said Section 2 now expands that. And I just don't know how insurance and Medicaid works with minors, and so I'm curious how some of that's going to work. Are we going to be then shifting funds to the other facilities that use Medicaid with the youth, and then on the insurance companies, they'll be sending a bill, and is that correct?
Thank you for the question, Assemblyman Hafen. Nobody knows how insurance works, so that is well outside of my understanding, even with my 4 degrees. But there's nothing in this bill that will change how providers are reimbursed for services that they provide. You did hit on something with the Title 10. Right now in the state of Nevada, if you receive Title 10 funding, you can give certain services to minors without their parental consent today in the state of Nevada. And one of the issues we've run into, which is why Section 2 mainly exists, is that there are now less providers in the state who are accessing that Title 10 funding. And so we want to make sure that there are still a robust amount of facilities where minors can get access to the services that they were previously able to access when those facilities were in fact receiving Title 10 funding.
If I may just follow up. And so that's kind of where I'm getting with is my concern here is if we shift some of these services and some of the payments away from these facilities, I mean, I don't want to say defunding Planned Parenthood because that probably end up in the headlines, but is that not a possibility of what we're actually going to do is limit the resources that are currently going to these areas by expanding where they can go?
Thank you for the question, Assemblyman Hafen. Let me try and address that in just a complete and utter hypothetical. I'm going to use easy numbers. Let's say right now today, or let's say last year, 10 facilities had Title 10 funding. Okay? What we're actually running into is this year, now only 3 have Title 10 funding. And so I'm ensuring that the other 7 can still continue to provide the services that they were providing before. And so there shouldn't be any drawing away from one particular funder to another. But that would happen if this bill didn't pass. Those 7 would now lose all of their services to the other 3 because they couldn't provide those services any longer, if that makes sense. Okay. And those are just hypothetical numbers. They're not meant to be factual, just illustrative.
I saw Miss Dodson move up to the front. Did you want to clarify? Okay, okay, all right. Thank you so much. We have a couple more questions. I'm going to go to Assemblywoman Newby next.
Thank you, Madam Chairwoman, and thank you, Senator Harris, for bringing this bill. My question really is around a group of folks that I don't think we've touched on yet in our youth population, and those are youth who may have want to express a sexuality beyond what their parents understand. And those folks have then the double issue of talking with their parents about sex, which is, we all have said is hard enough, right? But then to say, you know, I'm gay to their parents may be just a step even too far for them. And so what I appreciate about this bill is that those kids can get information and can seek prevention and treatment on their own, and hopefully that keeps them safer in that situation. So I was just wondering if you could speak to that, if that's been part of the discussion on this bill, or what your thoughts are on that.
Thank you for that, Assemblywoman Newby. Dallas Harris for the record. Absolutely. You all are the Health and Human Services Committee, so I'm probably not telling you anything that you don't know. But medical science has advanced to a point where there are options for you to proactively prepare yourself and your body so that you do not get an HIV infection. We can do that today. We can do that. And so, yes, if you are a child who is maybe gay and you don't want to tell your dad, but you got a boyfriend and you know you're going to do what teenagers do, although it makes us all feel a little squishy, you can access those services, those PrEP services. That's the drug that you can take. And we, again, want to make sure that the barrier to that is as low as possible. The state of Nevada has the highest rate of new infections in the western U.S. for HIV. There should not be one tool that we are not pulling out of our tool belt to try and address that issue. And again, if you have a child who is smart enough to have the foresight to try and prevent getting an STD, we need to make sure that happens.
Thank you for bringing that up. That is an important statistic as well. I have Assemblyman Koenig next.
Thank you, Madam Chair, and thank you for bringing this forward. First statement is, me as an optometrist can't check some minor's eyes without parental consent unless they're 18. I'll have to dig deeper that might have changed. I knew that's what it was when I started. Over the years, laws get passed and some of the general public just doesn't know what's going on. My question is, so some of the sexually transmitted diseases actually do manifest in their eyes. And over the years, I've had minors, not often, maybe 4 or 5 times in the last 20 years that I've found with that, with an infection. And I read the law and it says that it authorizes someone to treat them without parental consent, but I don't think it's mandating, right? So as a doctor, we look at a 17-year-old and, okay, yeah, but the lower the age goes, the bigger my concern goes. So there's no minimum on this. I know there is. If you've got a 9-year-old with a sexually transmitted disease, there's probably some law that's been broken. And with no floor, can a 9-year-old say, doctors have mandatory reporting, but this might muddy the waters on mandatory reporting a little bit. If before you had to, let their parents know, and most parents of a 9-year-old find out, they're going to pursue something. Without the advocates of the parent pursuing what might be happening. Can this muddy the waters of mandatory reporting if the 9-year-old is giving consent and the law says I can give consent to do that, and you can't tell my parents? Is a doctor still obligated to go contact law enforcement? That just was coming to my mind. Thank you.
Yeah, thank you for that question, Assemblyman Dallas Harris, for the record. So I have two things. One, this bill does not affect the treatment of an STD. That's currently law. Minor can today, even at 9, can consent to treatment for an STD. Okay? So that's not this bill, right? Second thing, this bill also does not touch on mandated reporting. Please continue. If you are a mandated reporter, please continue to report. This bill has zero effect on that, and I want everyone reported. If there is a child who comes into your optometrist's office or a doctor's office or their social worker's office or any other long list of folks who are mandated reporters, absolutely you must do that. This bill would not change that fact. And it would not impact any minor's ability to say you can't report it. You absolutely must, and you should.
Thank you for that clarification.
Thank you. Assemblyman Hibbets.
Thank you, Chair, and thank you, Senator, for being here. Nice of you to come up to the third floor and visit us. My question actually kind of dovetails off my colleague's last question, except mine is more of the, I'm looking at Section 1, Subsection 2, NRS 639-28085 specifically. So that same 9-year-old could walk into a doctor's office and seek preventative medication for, in this case, that particular NRS refers to HIV. And there is no mandatory reporting for that. It is, as far as I know, a doctor does not have to report preventative medication because no crime has been committed because it's preventative. Is that correct?
Thank you for the question, Assemblyman Dallas Harris, for the record. I will touch upon this and then kick it over to my colleague here to the right. That's a tricky one. I will say this. If a 9-year-old comes into your office and is asking for preventative services for STDs, you better ask a couple more questions. And to Assemblyman Koenig's earlier question, which I did not answer, no, there's nothing that requires them to actually engage in any particular practice, right? There's still all this autonomy. I don't think there's a requirement that if a minor, just because a minor can give their consent does not mean the doctor must, right, acquiesce to any particular ask or engage in any particular behavior, right? But I'll tell you, any doctor out there, if they suspect that someone underage is engaging in sexual behavior, there are laws in place, and those laws should continue to be followed. But I'll turn it over to Ms. Dodson for a little bit of extra color on that.
Sorry to interrupt. For the record, Joelle Gutman Dodson with the Washoe County Health District. And it is muddied waters, but the sexual age of consent is 16. So when we see minors under 16, we're going to ask some questions. If they're 9, CPS is involved, the police are involved immediately. If they're 15, and then we find out their partner is also 15, that might be a little different than if they're 14 and their partner's 21. Then we're going to get the law enforcement involved. So it's not a 12-year-old comes in and says, you know, I want condoms and birth control. We're going to ask a lot more questions. That's child abuse or sexual misconduct. So I appreciate the questions, but when we have very young people come in, there are a lot of things we're asking.
And Madam Chair, if I may just follow up on that as well. You know, there's a couple of reasons. There's a reason why I've said this several times. The existing law is that they can be treated for an STD. And so if a 9-year-old comes in and they've got an STD you're going to ask some questions. And the framework for what a doctor or a mandated reporter must do when things like that occur already exists. They are seeing, unfortunately, these scenarios happen occasionally, and they're well trained on what they're supposed to do. This bill as drafted does not create new issues when it comes to what happens when you suspect a minor who is well underage is engaging in sexual behavior.
So with that being said, why not put a minimum age of 16 in here? If they're under 16 and they're going in for preventative HIV treatments, maybe we want to know about that.
Thank you for the question, Assemblyman. Again, if they're under 16 and they're coming in for preventative HIV treatment, then a conversation will be had with that minor, and potentially law enforcement will be involved. This bill, as currently drafted, age requirement or no, will not change that fact. This is not, as some may believe, a free-for-all for 12-year-olds to be engaging in sex and their parents not to know. That's still illegal. It will continue to be illegal, and this will actually not make it any easier to circumvent the law. We in the state of Nevada define what a minor is, and that also is not affected by this bill. Right? So there are lots of pieces, I think, that are working together here to result in the bill that you see today. And if we want to change the definition of what a minor is, then that's a different bill that we would have to bring.
Sorry. So let me make sure that
You have a follow-up?
Yeah, I just want to make sure that I'm clear. So let's say, we'll make it easy, a 15-year-old, under the age of consent, cannot consent to sex with an adult, walks into a doctor's office and says, hey, whatever the story is, I'd like to be have preventative treatment for HIV under 639-28085. As far as I know, and I'm not a doctor, but as far as I know, there's no mandatory reporting for preventative treatment. If the minor 15-year-old is telling the doctor, I'm thinking I might want to have sex at some point, and I want to be protected, there's no evidence there that there's a crime committed. Doctors aren't under any legal requirement to notify anybody. And that's my concern. Why not list the age at 16?
Thank you for the question, Assemblyman Hibbets. So I also am not a doctor. I'm not a mandated reporter either, and so I cannot actually give you a firm answer on when the threshold is met for you to have to report. However, if that threshold is met, you absolutely must report, and that will continue to be the case.
I also want to point out that there's nothing precluding a 15-year-old from asking a physician for treatment at the moment. This would allow a physician to make, in the best judgment of the public health and the health of their patient, whether that treatment is reasonable for that person or not. And that is the only piece that changes with this piece of legislation. The reporting, the gut feelings, the additional questions that a physician would have to ask does not change. But if that physician feels it is in the best interest of that patient, then they have the autonomy under this bill to prescribe those preventative treatments.
And Chair, if I may, I'll just, again, follow up on what Ms. Dodson said, right? So if it's a 15-year-old and their partner's 15, that may be a different scenario than if they're 15 and their partner is 21, right? And I don't know about y'all, but I'm going to leave it to the experts, right? I'm going to leave it to the doctor to have discussions with their patient about what is best for them in any given scenario. And then I'll also just reiterate, nothing requires the doctor to actually prescribe if they feel uncomfortable doing so. And again, nothing prohibits them from reporting if they feel that that is the proper avenue as well.
Thank you, Chair, for the latitude, and thank you, Senator, for the answers.
Thank you. All right. Anyone else have questions before we go for a second round with Assemblyman Gray? All right, we're going to do a second round then, and I think Assemblywoman Gonzalez went first, so I'm going to let you go first next, and then we'll go to Gray.
Thank you so much, Madam Chair. My question was, I was just in this dialogue that we've been having, I was curious, what are other states doing in our surrounding West, and how does that impact this, really critical issue that we have? Thank you.
Thank you for the question, Assemblywoman Gonzalez. Dallas Harris for the record. Unfortunately, I don't have what would be kind of like NCSL's version of sexual health for minors around the country. I can tell you that federal organizations like the CDC do recommend that states pass legislation similar to what we're doing today to address the very issues that I think we should be addressing. But I will get Mr. Robbins on it right away.
Mr. Robbins, please.
Yes, Eric Robbins, LCB Legal for the record. I actually have, the CDC has a handy chart on the internet about which states have these types of laws. And for STD testing, there are 13 states that have a law similar to this, and they range ideologically from California to states like Oklahoma and South Dakota. So, and then there are other states that have laws specific to HIV. So,
I think it would be really curious to see where Oklahoma ranked in their STI transmission before and after they passed that piece of legislation, because I think they were one of those higher transmission states for a while. Assemblyman Gray.
Thank you, Madam Chair. I'm going to use a little bit different scenario to try and illustrate and see how you feel about that. So both my daughters, as they were growing up, I had a tremendous fear of them pulling out on a Highway 50 and driving on Highway 50. Did not want them to drive until the very last minute. What would you feel about a law that was passed that said, well, if they want to drive, you can still help them drive, even though it's against my wishes as a parent, and it's not the best or safest behavior for them to be engaging in, especially without the parent's consent.
Assemblyman Gray, Dallas Harris for the record, I would suggest that's the state of the law now. Once they have their driver's license, you can tell them they can't go anywhere, but they're still actually free to drive on the freeway. And they're actually free to get their driver's license. You know what? We'd have to ask maybe someone in growth. I don't know if parental consent's required to get a driver's license. So once we say you're of age, you can go get one. I don't know if that answers
Clarify that real quick.
question. Okay,
I'm sorry,
go ahead.
underage. I mean, there's a lot of us kids that, drove underage. We learned how to do it. And, and actually, I don't think you can actually you only get a provisional at 16, and you're still subject to parents' rules and regulations and everything else until you're 18. But, so if you had a 15-year-old kid or a 14-year-old kid that said, hey, I need to drive, for whatever reason, will you teach me? And it was legal under the law, but the parents were saying no. How would you feel about that one? Because we all know that is a very dangerous behavior to be taking part in.
So, Assemblyman Gray, I don't know if I'm quite understanding the scenario. Are you suggesting a 14-year-old kind of steals your car keys and jumps in the car without your permission?
I think I'm going to take chair privilege here and say this is just not related enough to the bill to vet any further. It's just not related to the bill language at hand. And you bring up interesting points and comparisons, but it's really like apples to bananas. And for this particular scenario, I'd like to stick with where the language is going and the scenarios related to that language.
And I appreciate that. I was just trying to draw the correlation. If a parent believes it's dangerous behavior and they don't want their child taking part in it, it should ultimately be up to the parent to be involved in the situation.
And I think that even in that situation, right, I'm doing the thing I said I don't want to do. A child can still do that. A child can still take a car and they can still drive. And what happens is a mandatory reporter, a police officer, finds them on the road and takes them to their parents. I mean, there's the similarities. Kiddos are going to do what kiddos do. And we have to, as a public health a prerogative, protect them from harming themselves to our best ability, right?
And Chair Peters, if I just may briefly, I would hope, Assemblyman Gray, if your underage child is going to steal your car, that they still wear their seatbelt. That is what I am likening this to, more than anything else. Let's make sure they've got their seatbelt clicked and we don't have to jump through any hoops for them to put it on.
Thank you. I don't believe I have any other questions, so we will move into testimony.
Okay, thank you so much, Chair. I have about 20 minutes late for judiciary. If you don't mind, can I be excused for the testimony?
Yes, please go ahead.
All right, thank you so much. Have a great day, everybody.
Thank you. All right, we will move into testimony. As I said at the beginning of the bill hearing, we are limiting support, opposition, and neutral testimony to 30 minutes apiece. Each person who would like to provide testimony will be timed on a 3-minute timer so that we can ensure people have access. If you don't need the full 3 minutes, I would suggest dittoing and moving on because there are several people who would like to provide testimony today. So we will begin. It is 1:22 with support testimony on Senate Bill 172. You may begin.
Good afternoon, Chair. For the record, my name is Joelle Gutman-Dodson, representing the Washoe County Health District today in support of SB 172. On the other side, we had one of our health educators in our STI clinic co-present this bill with Senator Harris, as well as a representative from Southern Nevada Health District. So all of the STI statistics are on Nellis from the previous presentation. We are currently 5th in the nation with the highest STI rates, and that just because we've gone down a couple we're not always number 1 anymore, it doesn't mean our STI rates aren't going up. Just nationwide, they're going up at an exponential rate. For example, in Washoe County, we've had our 13th case of HIV this year, just in May. Last year, we had a total of 10 in the whole year. So HIV is still prevalent, it's still around, and reckless behavior is as well. So this is a safety tool, and it's a safety tool, not for necessarily the parents in the room that have kids that can talk to their parents about what's going on, but this is for kids that don't have that. And that's one of the first things we ask in our clinic. Do you have a safe adult you can talk to? And oftentimes the answer is no. The parents aren't supportive of their sexual orientation. They're not supportive of their behavior. And I think we all were teenagers at one time. Just because our parents aren't supportive of the behavior doesn't mean we stop doing it. But we do congratulate those kids that are trying to come in and do something safely and responsibly. And I think that's a good indicator of the choices they're making if they're trying to get some preventative protection or some further education, and they don't have that adult to go to and get those answers from. So I just want to just end that we're in support. As Nevadans, we all know we have a long history with teen pregnancy, with high STI rates, with one of the highest rates of congenital syphilis in the country. And this is just one more, to use Senator Harris's words, like seat belts that will help us move in the right direction of lowering those numbers. Thank you.
My name is Kennedy McKinney, for the record, representing Nevada Women's Lobby here in full support of SB 172. This bill clarifies and expands the rights of minors to access healthcare services related to preventing sexually transmitted diseases, including the prescription and administration of contraceptives without parental consent. As an organization that advocates for women's health and reproductive rights, we believe that minors should have the ability to make informed decisions about their own health care, particularly when it comes to sensitive and personal issues related to sexual health. Allowing minors to access confidential and comprehensive health care services related to preventing sexually transmitted diseases, including contraceptives, is crucial to reducing the rates of unintended pregnancies, sexually transmitted infections, and promoting overall health and well-being. We appreciate that 172 ensures that minors give their express consent before any examination or treatment is provided, as it reinforces the importance of informed consent and patient autonomy. And we also appreciate Senator Harris's willingness to bring this bill forward. Thank you for your time.
Thank you. Please go ahead.
Chair and members of the committee, for the record, my name is Jessica Ferrato, here today on behalf of the American College of Obstetricians and Gynecologists. We are here in support of SB 172. Allowing teens to access contraception reduces teen pregnancy rates. Some teenagers don't have an adult they can talk to about contraception and pregnancy. SB 172 allows teens to give consent to contraception. The bill does not interfere with a parent's right to discuss contraception or sexually transmitted diseases at home. We urge your support for the bill and thank you for your time.
Hello, Elise Monroy with Bell's Case Government Affairs today. We have officially entered Be in Two Places at Once season. So first I need to tell you that the Nevada Coalition to End Sexual and Domestic Violence is in support of this bill, and they will be submitting their full remarks on Nellis. They had to run to judiciary. I'm here today with remarks on behalf of the Nevada Public Health Association, who is in support of Senate Bill 172. Senate Bill 172 allows minors to access preventative health services for STI and STDs that they can get treated for. So this is common sense public health prevention. NPHA supports a healthcare system that allows all people to access evidence-based supports and services, but this includes youth that may not have a safe or responsible adult at home, but this also includes youth like me who had great, loving, supportive parents that talked to them about these things, but to this day, I'm still terrified of disappointing them. So this bill gets us closer to a system that is safe and easy to access for everybody that needs support. So we urge your support and passage of this bill. Thank you.
Good afternoon, Chair, Vice Chair, and members of the committee. Good afternoon. My name is Carl Catarata, here on behalf of the Human Rights Campaign of Nevada. At a time where certain states across the country are rolling back protections and rights for LGBTQIA individuals, I'm a proud lifelong Nevadan living in a state where we continue to be a champion in human rights, and a state where our legislature moves forward but not backward. So on behalf of your constituents and on thousands of supporters of the Human Rights Campaign in Nevada and our 3 million members across nationwide, we thank you for the opportunity to deliberate and help you inform your deliberation on AB 172. We strongly support this legislation and urge that you advance it. Irrespective of age, the ability to say in one's healthcare, particularly in preventative care such as birth control and treatment for youth and for sexually transmitted infections is critical to one's health. Thus, HRC supports AB 172 or SB 172 that would safeguard the ability and ensure that adolescents have legal access to reproductive care, such as birth control, STI testing, and treatment. So this would also further allow us to receive federal Title 10 funds in order to provide as much needed access to reproductive health care and contraceptives. So this bill, as folks have been noting, doesn't remove parental rights, but as many of those who have submitted opposition in the Senate have said, we would like to see this be supported from all of you, and we look forward to working with each and every one of you in your respective districts. The Human Rights Campaign and LGBTQ individuals across the state need it. Thank you so much for your time and consideration, and we look forward to working with you shortly. Thank you.
Chair, members of the committee, this chair is awful short. Jonathan Norman, Nevada Coalition of Legal Service Providers. We represented at any given time, 3,600 kids in foster care. And, statewide, foster kinship, they testified earlier in session that at any given time there are about 30,000 kids in the state living with kinship caregivers. So we have a lot of kids that may not have that trusted parent that they can go to on an issue like this. Certainly I've represented kids who are on runaway status, so they've gone AWOL from the Department of Family Services. And a medical professional is another adult who's a positive influence on a kid's life. And any opportunity I have to make sure that my foster kids are engaged, whether it's with teachers and going to school, even if they're on runaway status, or with a medical professional, is an opportunity I encourage my kids to take, because where do they turn if they don't have those trusted adults in their lives? And then just another point, if a doctor has the choice about whether to follow through with, a 12-year-old comes in and says, I want to get, this treatment or this prophylactic treatment for a potential STI, the doctors, whether they decide to treat or not, their obligation to report does not change. Regardless, they have an obligation if they suspect that child abuse is happening, with those follow-up questions, to file a report as soon as practicable, no later than 24 hours. So I think, whether, right now, if a child comes to a doctor and says, I want to get X, Y, and Z because I want to engage in risky behavior, I think that doctor right now has an obligation to report whether they're allowed to treat or not. So thank you.
Thank you. Is there anyone else in Carson City who'd like to provide support testimony? Seeing no one in Carson City, is there anyone in Las Vegas that would like to provide support testimony? Seeing no one approach the desk, BPS, would you check the public line for support testimony on Senate Bill 172?
To testify in support of Senate Bill 172, please press *9 now to take your place in the queue.
Hello, thank you, Chair Peters and committee. My name is Dayla Gibson, DAELA GIBSON, and I'm representing Planned Parenthood Marmonte. We are in support of this bill and ditto the other statements in support. Thank you.
Thank you. BPS, are there other folks on the line?
Good afternoon, Chair and members of the committee. My name is Brianna Escamilla, BriannaEscamilla, for the record, and I'm here on behalf of Planned Parenthood Votes Nevada in support of SB 172. We believe that the ability to have a say in one's health care, especially preventative care like contraception and testing and treatment for sexually transmitted infections, is crucial not only to one's reproductive freedom, but overall health and well-being over their lifetime. This bill affirms that right and recognizes the importance of allowing all people to have autonomy over preventative health care like STI testing and treatment and contraception. We are proud to support legislation that empowers people to access the care that they need, and we thank Senator Harris for introducing this bill. Thank you.
Thank you. BPS, are there other callers?
Good afternoon, Chair and committee members. My name is Deanna Taylor, BIANNAH, Taylor, TAYLOR, resident of Las Vegas and a mother of four. Particularly as someone who has a good relationship with their eldest and has had children from other families come to them because they don't have a good relationship with their primary caregiver. Deferring control in those types of situations to those people that they don't trust is almost naive at best or cruel at worst, because those types of situations, if the situations where good parents are going to be involved, they're already going to be involved, and this doesn't change or change any of that, as others have said. So I please support this bill, because those that seek care really should get it. Thank you.
Thank you. BPS, please add the next caller.
Good afternoon, Chair and members of the committee. For the record, my name is Christine Saunders. That's CHRISTINE, Saunders, and I'm the Policy Director with the Progressive Leadership Alliance in Nevada. I will also just echo the sentiments of the previous testimony and urge you to support Senate Bill 172. Thank you.
Thank you. BPS, next caller, please.
Hello, my name is Cy Burnaby. Thank you, Senator Harris, for bringing this bill. I support Senate Bill 172. A recent poll showed that 60% of parents were raised thinking that sex is taboo. I am a parent of 2 young children, and also that same poll showed that 1 in 4 of us find it awkward to have those conversations. So even if you are a parent that has said to your children that they are free in coming to you, that they can come to you about anything, can they really? Have you had the conversation with your child about condoms, HIV, PrEP? Have you talked to them about these things? Because if you haven't actually had this conversation, told them where they can buy condoms, told them where they can get STD treatment, that conversation is not happening. I would also ask you to ask yourself that when you were a teenager, did you tell your mother or your father or your parent that you were thinking about having sex? Did you go up to your mother and father and say, I lost my virginity? Did you actually say that to your parents? Most of us did not. Because of that, we need to trust that there are people out there who can have these conversations with our kids, whether they are doctors or they work in a clinic or they're a sex ed teacher. We need to trust in that because we didn't have these conversations with our parents, and our kids also do not come to us for many reasons. Because of that, I support Senate Bill 172.
Before you go, would you please restate and spell your name for the record, please?
Yes, I'm sorry. Cy Burnaby, Sybernabi.
Thank you so much. BPS, would you please add the next caller in support?
Hi, good afternoon, Chair, members of the committee. Will Pregman, P as in Peter, REGMAN, representing Battleborn Progress. We are in support of FD 172 for the reasons already stated. I'll simply say ditto and submit comments in writing. Thank you.
Thank you so much. BPS, next caller, please.
Good afternoon, Chair Peters, members of the committee. My name is Steve Messenger. That's Messinger. I'm with the Nevada Primary Care Association, representing the state's federally qualified health centers and one of the state's Title X grantees. I'm going to be a ditto as well for all the reasons stated above. I would like to also follow Ms. Gutman in referring you to our exhibit from the first hearing where we laid out our ideas on this Senate Bill 172 and why we support it. Thank you very much.
Thank you so much. BPS, next caller, please.
If you have recently joined and would like to testify in support of Senate Bill 172, please press *9 now to take your place in the queue.
Good afternoon, Chair and committee members. My name is Jessica Munger, Munger, representing Silver State Equality, Nevada's statewide LGBTQ+ civil rights organization, and we are in strong support of SB 172 for all of the reasons you've already heard. Thank you.
Thank you. BPS, next caller, please.
Chair, there are no other callers to testify in support at this time.
Thank you so much. So we are at 1:38. And we're ready to be done at 1:52. So I appreciate the brevity of folks testifying today. Thank you so much. All right, we will move into opposition testimony first in our physical locations and then on the phone. Again, we are doing a 3-minute per person timer so everyone has the opportunity to speak and hopefully within that 30-minute time frame. Please remember to state your name for the record. We will start here in Carson City. You may begin when you're ready.
Good afternoon, Madam Chair, members of the committee. Bob Russo for the record. I oppose Senate Bill 172. I'll mention too that as of 1:30 this afternoon on Nellis, 83% were opposed to this bill, or a total of 377. 16% were for it, for a total of 75, and there were no neutral. This bill would allow minors to consent to certain medical services for the prevention of sexually transmitted diseases, such as contraceptive drugs or devices, without the consent or notification of parents or legal guardian. And I believe that it is reasonable to conclude that this would likely include the HPV, or the human papilloma virus vaccine, which, for your information, carries significant risks. Parental guidance, or that of a guardian or relative or adult family friend or adult teacher, is essential. Children are just incapable of making sound medical decisions which may impact them for the rest of their lives. And this is especially true when it comes to improving drugs or vaccines that they know next to nothing about. A child or youth can easily agree to a medical treatment offered to them by a medical professional. They can be easily swayed or influenced to agree with something that might not be in their best interest. That is why parental involvement and consent must be required before any medical treatment or procedure can be given to a minor. Kids need their parents or some adult in their corner, and caution is prudent. Additionally, given that this bill allows minors to receive treatments for the prevention of sexually transmitted diseases, in my opinion, this bill encourages sexual promiscuity and reckless sexual behavior and does not prevent them. To conclude, this bill places the state ahead of parents and adults and the family when it comes to the welfare of children. It clearly evades and violates parental rights. Please oppose it. Thank you very much.
Thank you. Please go ahead.
My name is Kathleen Palmer, Palmer. Good afternoon, Chair Peters and council members. Even if minors are allowed to receive medication without parental consent, there is no guarantee that all of those drugs are safe. Several drugs marketed as beneficial have now been proven to cause illness and death. Thalidomide was introduced in Europe in 1957 as safe for pregnant women. 4,000 children whose mothers took it died. 6,000 survived with birth defects, including missing limbs, eye problems, urinary tract issues, and heart problems. Thalidomide was withdrawn in 1961. DES, diethylstilbestrol, a synthetic estrogen, was approved by the FDA in 1941. By the early 1970s, daughters exposed to DES in the womb were found to have high rates of a rare vaginal cancer. Women who took DES also had a 30% higher chance of breast cancer. In 1975, the FDA withdrew approval for DES. The National Cancer Society estimates that persons harmed by DES may be as high as 10 million. The FDA approved Merck's HPV vaccine Gardasil in 2006. There are many reports of adverse reactions, including death. In March, Judge Robert J. Conrad ordered Merck to give their database of Gardasil adverse reactions to the attorneys representing the dozens of men and women pursuing cases against Merck. With thalidomide and DES, we have the benefit of hindsight. 80 years later, the CDC is still tracking harms to the children and grandchildren exposed to DES. It can take generations to expose the harmful effects of some drugs. With Gardasil, we are still in the discovery process. Even if all children and teens in Nevada are injected with Gardasil, they would be protected from less than 1/4 of the HPV strains, as Gardasil only claims to protect 9 of the 40 strains of HPV. DES and Gardasil were approved by the FDA and promoted by the CDC. This proves that adults are capable of making mistakes that cause grave harm and death. It is reckless to endanger children and teens by allowing them to make decisions regarding medical care without parental guidance. And I will be submitting written documents to back up all my claims through research. Thank you.
Thank you. Please go ahead.
Thank you. Good afternoon, Madam Chair and members of the committee. My name is Katrin Sienkiewicz. I'm a Douglas County resident, a parent, and a board member of Health Freedom Nevada. I'm here representing approximately 5,000 Nevada families who oppose SB 172. This bill is an infringement upon parental rights and will potentially put children in harm's way, given that there is risk associated with all drugs and medical interventions. This bill will allow children of any age to consent to pharmaceutical drugs, medical treatments, and device implantation. It asserts that parents have no stake in their children's medical decisions. This is egregious on many fronts, the least of which being that it's the parents who are then financially responsible to take care of their children should they experience adverse events from a drug or a treatment, and it's the parents who are ultimately charged with taking care of the kids as well. SB 172 asserts that a child is capable of providing informed consent to drugs or medical treatments. Informed consent is a principle in medical ethics and law and states that a patient or their guardian, in the case of minors on their behalf, must have sufficient information and understanding before making decisions about their medical care. That includes gathering pertinent information, including risks and benefits, and their right to refuse treatment. Given that every single drug or medical treatment does come with risk, it's critical that the patient or their guardian be qualified to provide true informed consent. Do you think that kids are capable of this? That they can read and understand complex pharmaceutical package inserts? The same kids who can't drive, vote, serve in the military, buy alcohol, or get a tattoo because in the eyes of the law they're not mature enough to do those things? At which age do you all think that kids are capable of making such a decision? Is it 4? Is it 8? I mean, this bill literally has no minimum age. The presentation today did focus primarily on teenagers and STD prevention, so why are we even considering this bill without having a reasonable minimum age in it? I want to also touch on the HIV treatment drugs that were the primary focus of Senator Harris's presentation to the Senate during that hearing. There wasn't much mention of it today, a little bit, but the entire presentation on the Senate side was on HIV prevention drugs. Current United States CDC HIV prevention protocols include PrEP, which is pre-exposure treatment, and the focus, like I said, was really on those drugs in the Senate hearing and getting access to those drugs for the kids. I have to tell you that the 3 main drugs given today for PrEP are Truvada, Descovy, and Apretude. Each of them comes with a black box warning, which is the highest FDA safety warning level placed on drugs, and it indicates that they carry serious and sometimes life-threatening reactions. The FDA requires the disclosure on the labels of these drugs. They can and do cause kidney failure and bone loss, among many other adverse side effects. And there's a lot of reports of such injuries. In fact, there's litigation currently in the courts on those, against those drugs. So given the fact that they're so dangerous and that the drugs themselves can cause lifelong debilitating illness, can we reasonably expect children to comprehend those risks? I want to end with just saying that our fear is that passage of SB 172 would allow minor children to accept these drugs without informed consent, without a full understanding of the potential risks and their right to decline the drugs, without their parents to protect them and to make the best decision for their future. Please do the right thing and keep children's medical decisions in the hands of their parents. Vote no on SB 172. Thank you very much.
Thank you for the comprehensive testimony. I just wanted to let you know, I did go over 45 seconds on that one, but I thought it was important to get that in the record, so thank you so much. Please go ahead.
Thank you, Madam Chairman. My name is Janine Hansen. I'm the state president of Nevada Families for Freedom. In 2013, Nevada Democrat Senator Mo Dennis introduced SB 314, the liberty interest of a parent in the care, custody, and management of a parent's child is a fundamental right. This particular bill violates the Nevada Revised Statutes, NRS 126.036. One of the major issues that has not been discussed in this bill is Section 2. What this bill does is remove the prohibition against family resource centers in Nevada providing contraceptive hormonal drugs, devices, dangerous HPV vaccines, and pre-exposure HIV drugs. This has never happened before in Nevada, although federally funded Title X clinics have provided STD treatment. Nevada Family Resource Centers have never been able to do so. If you look at the list of Nevada Family Resource Centers, I provided that in my testimony online, it includes many schools. So we are going to have family resource centers in the schools providing contraceptives and drugs and all kinds of treatment for children without parental notification or consent. This includes O'Brien Middle School in Washoe County, Wooster Early Learning Center in Washoe County, Bernice Matthews Elementary School in Washoe County, and Sparks High School and Sun Valley Schools in Washoe County. I have the list of all those on my testimony. Many of the family resource centers, as I said, are in the schools. This is a radical change from our current law in allowing family resource centers to violate parental rights and for taxpayers to have to pay for their rights to be violated. There are more than 64,000 case reports of HPV vaccine adverse reactions, and only about 1% of adverse reactions are usually reported to the Vaccine Adverse Events Reporting System. Some of these many adverse reactions include autoimmune diseases, chronic fatigue syndrome, death, fibromyalgia, lupus, reproductive disorders, arthritis, diabetes, inflammatory bowel disease, multiple sclerosis, and more. Parents need to be involved in these decisions. Thank you, Madam Chairman.
Thank you. Great timing, Ms. Hanson. Please go ahead.
Thank you. Chairwoman and committee, my name is Lynn Chapman, and I'm the state treasurer of the Independent American Party. And I agree, we should leave things to the experts, and we have to remember that the parents are the experts when it comes to their children. I was a homeschool mom, and I homeschooled my daughter all the way through high school. And I taught my daughter age-appropriate sex ed all the way through. I told my daughter she could ask me anything because I knew more than her friends did, and that I would always tell her the truth, which I did. We, the parents, are seeking to assert our rights to determine the upbringing and the education of our own children. This is a state, federal, and natural and God-given right. The very cornerstone of our society is the family. The Supreme Court has determined that parents have the fundamental right to direct the care, custody, and control of their own children. The court has also determined that the government shall not interfere with this right unless and until a parent is proven unfit. There are many court cases, including Troxel, where the court states that, quote, so long as a parent adequately cares for his or her children, there will normally be no reason for the state to inject itself into the private realm of the family to further question the ability of the parent to make the best decisions concerning the rearing of that parent's child, unquote, 530 U.S. at 6869. I did want to mention, too, that I thought the age of consent was taken out of the laws due to the fact that question 1 passed the ERA. There was no age of consent in that question, and now it's in our state constitution, so I don't know that we do have an age of consent anymore. What this bill does is direct the state to interject and interfere with our families. We are saying loudly and clearly, we will direct the care, custody, and control of our own children. I, along with many other families, are saying this loudly and clearly to vote no on SB 172. Thank you.
Casey Rogers for the record. There's always been two pillars of a foundation for any civilization. The first was religion and the other was tradition. That happens to be founded amongst families, mostly, correct? I'd just like to say, as a parent, I'm appalled to see that these bills are coming through, that you're trying to take the rights of my decisions that I have for my children. Do all of you have children? Does Senator Harris have children? Does she know what that's like to have somebody come at you and say, this is coming at your parental rights? Then I would also like to say that there is a book, if you guys could do some real research, it's called The Real AIDS Epidemic, How the Tragic HIV Mistakes Threatens Us All, by Rebecca V. Callhall, forward by Nimaha Ostrom. In that book, I quote, it says, medicine's most rigidly adhere to conventional wisdom of the last 40 years is that the human immunodeficiency virus HIV is the sole cause of AIDS. Rebecca Callshaw is uniquely qualified to question that paradigm. With a PhD in mathematical biology, she upends the problematic arithmetic that supports the HIV hypothesis, the strangely unchanging number of HIV positive people since the late 1980s, their location in the same geographical regions, occurring among the same risk groups. She nullifies the certainty of the medical markers used to diagnose AIDS, the inexplicable loss of CD4 plus T cells, the fallacy of the viral load test, the weakness of PCR testing. In the real AIDS epidemic, Rebecca dismantles the conventional wisdom that rules HIV research. You guys could really benefit from reading books like this and really become more educated. The COVID scandemic, she talks about that in here. There's a lot of things that have once been said was and is now saying that it's not. Masks happen to be one of them. So please do further research. Thank you.
Please go ahead.
Good afternoon. Joy Trushenski, Trushenski, for the record. I believe the pushing of extensive pornographic sex education in our schools is the main reason there is so much sexual activity among our minors and teens. Also, the laws like SB 172, pushed by this legislative body, undermines parents, is wrong. Please vote no on SB 172. Parental rights are a fundamental, God-given right, and government's responsibility is to protect and uphold our rights, not undermine them. This bill allows the state government to intervene in our families. Once again, existing law allows healthcare givers to treat a minor for STG infections without parental consent or knowledge. I was and am so against this. Additionally, the bill authorizes using our tax dollars to violate parental rights, once again by authorizing family resource centers to provide contraceptive drugs, devices, dangers, HPV vaccines, and pre-exempt HIV drugs to minors without parental consent. This is wrong. Children are not generally mature enough to understand the risks involved in accepting these drugs or medical procedures. Children are the responsibility of their parents or guardians in all aspects of their lives, not government. Please vote no on SB 172. Thank you for your time.
Thank you. I appreciate you trying to make sure that we can hear you, but sometimes speaking so closely to these microphones because they're well capturing microphones will muddy our recording for the secretaries, so and for the recording online. So we can try and keep a 3 to 6 inch distance from those so we don't blow out those the recording. But thank you. Please go ahead.
Hi, good afternoon, Madam Chair and fellow individuals up there. I'm a little bit nervous, but I am totally opposed to this bill. It appears to me that it's all about circumventing the constitutional rights of parents to be involved in the medical decisions of their children. The government does not, should not be involved in this. This is wrong. It's not right at all. Under the guise of preventing the transmission of sexual transmitted diseases, this bill essentially endeavors to violate the people's constitutional rights. And I just want to remind you, we are many, you are the few, and as mentioned before, 83% of the people reported on Nellis are against this bill. We don't like it. We don't want it. It's being shoved down our throats. And people need to listen to the doctors up here on this podium that know better than most of the other people that are just doing it for fame and fortune. So I'm just wondering, like some of the federal people that never did take an oath, did you guys take an oath to, and do you believe in it? Do you believe in serving the people and not your own personal agendas? It's over and over again, this is what I see, overwhelming opposition to a bill, and it just keeps moving forward. It's not right. The number of children being removed from public schools from parents has been escalating because the parents do not like what's going on in the schools and wait till they find out that their kids can go over to a resource center inside the school and get these drugs and whatever else these people will be doing there. I think that the schools are going to be losing a lot more children that will be going to homeschooled and private schools because of something like this. So thank you for your time. I appreciate being able to give my opinion on this, and I hope you do the right thing for the people.
Thank you, and I don't know if this was your first time testifying, but congratulations. Please.
Hi, my name is Lori Johnson, LORIJOHNSON. This bill affects our daughters and our granddaughters. This bill violates parental rights. We all are accountable before God when we comes to raising our children. I am against this bill and I vote no. This is a terrible bill, and God forgive everybody that votes yes. Thank you.
Please go ahead.
Good afternoon. This is Barbara Jones for the record. I have taught all ages from pretty much the cradle, rocking the baby, to through college to adults, middle school, high school. The young people are not qualified to make these kinds of decisions. I am so against this bill. Also, it takes a lot of trust to let a health officer, licensed physician, physician assistant, registered nurse, pharmacist, or clinic, or volunteer from a granted facility to treat your children. Did you know that one group has said that May is Sexual Experimental Month for 9 to 12-year-olds? Who's teaching them that there's consequences for actions? Haven't heard a thing about it. Let's help them get something that will protect them. And all of the protections aren't 100%. So this is just not right, as was said before. And to have a volunteer do this to your children without any adult in the child's life knowing about it, it's absolutely against the parents' human rights. I heard about human rights this morning. And also the child to have good training. The Bible says train them up in the way they should go, and not teach them the wrong way to go. So I thank you for your time, and also I stand with the others, the dangers of a lot of the drugs and the treatments, and what has been said before, especially also Ms. Hansen's testimony. So please, do not pass this bill. Thank you.
Thank you. I do want to correct the record that this is not referring to a volunteer with no medical background. This is referring to a physician, physician assistant, registered nurse, or pharmacist who may volunteer at a family resource center, because not all physicians are paid at those facilities.
Is it right here?
Yeah, yep, a volunteer at a family resource center who is a physician, a licensed physician. Yeah. Okay, please, do we have anyone else who would like to come up and testify in opposition in Carson? Because we are almost at the half an hour and I'd like to get to Las Vegas and the phones. Okay, please go ahead.
Good afternoon, Madam Chair and members of the committee. My name is Sarah Yelowitz and I live in Reno, Nevada. I'm asking you to vote no on SB 172. I can't believe we're sitting here in this room today talking about whether 3-year-olds should be able to agree to accept a wide range of dangerous, life-altering medical products and procedures without the knowledge and consent of their parents. That's insane. There's a good reason that this bill is being called the Predator Protection Act. SB 172 would allow predators and criminals to try to cover their tracks while harming all children and families across the state. I'd also like to know how exactly a newborn is assumed to have consented to these medical treatments. And what about a kindergartner who may be coerced into accepting a life-altering procedure at school that they aren't supposed to have? Where's their right to proper informed consent in all of this? Does this mean that brand new parents in the hospital have to worry even more now about exactly what kinds of injections may be given to their new baby in the newborn nursery without their knowledge or consent when their baby is out of their sight for 10 minutes? Because that's certainly what this sounds like when considering that there's no age limit in this bill and it applies to children as young as 1 day old. Parents have a fundamental right to protect their children from dangerous medical procedures and to be involved in any medical decisions regarding their minor children. We will not stand by and allow this infringement on our fundamental right to direct the care and upbringing of our children. This bill is an outrageous violation of parental rights and the right to fully informed consent. Please vote no on SB 172. Thank you.
Thank you. Seeing no one else in Carson City come up for opposition testimony, we will move to Las Vegas. Please remember to state your name. I do want to put on the record that is 206. I'm going to give an extra 10 minutes to Las Vegas, and then we'll move to the phones and we'll see who is left at that moment. But that will put us at about 40 minutes for opposition. Please remember to state your name for the record. Go ahead when you're ready.
Good afternoon. I'm Monica Marquez, mother of 4. I had something pretty lengthy written out, but everybody covered everything beautifully, all the points that I wanted to cover. If you guys vote for this bill, that truly shows your guys' agenda, because there are so many of us parents that are standing up for our kids who do not want this bill passed. Your guys' job is to stand up for us, and the fact that we're just speaking about trying to protect our kids and you guys keep trying to push these bills is so disturbing. I really hope that you guys take into consideration that we are the parents, we are the experts, we are the ones that birthed, and we're the ones rearing our kids to do right. Unfortunately, that's not the case for everybody, and I'm sorry that that has to be the case for them. But we care. Us parents, we care. I'm a mother that cares, and I will fight for my babies. Another thing that I wanted to say was, Assemblyman Gray and Hebbett, thank you so much for standing up for our parental rights that are being infringed on. I appreciate your guys' work and efforts, so please vote against no on SB 172. Thank you.
Thank you. Next, Oppo.
Hi, thank you so much, Chairwoman Peters, for allowing us to have our time, because we've been waiting here patiently, and I really appreciate that. My name is Daphne Lee, and I'm a lifetime resident of Las Vegas. I adamantly oppose this bill and urging you to do so as well. I personally do not know a single parent who I have discussed this bill with that agrees with this. I've lived here my whole life. We have a very long casted net of people that we know in our community, and anyone who hears about this bill thinks it's egregious. And I agree with Monica. everything was pretty much said and very well from the people in Carson City. So I just want to touch on a couple things that came to mind when I was listening to Senator Harris and the health people. The bacterial infections that they kept reiterating as this Trojan horse for the reason for this bill, gonorrhea, syphilis, and chlamydia, these are the main STIs that are out of control in our state. Those are bacterial infections. There is no prophylactic treatment for those. So this bill has nothing to do with those diseases. The only way that you cannot get those 3 bacterial infections is through abstinence or condom use. There's no prophylactic treatment. The 2 prophylactic treatments that they mainly want to use using this bill is HPV vaccinations, which everyone already talked about, are dangerous. They are in litigation for fraud, harm, and death. That is a fact. It is one of the largest law firms taking these cases up. So what's going to happen when somebody passes this bill and children are given autoimmune disorders and then they pull it off the market when these lawsuits wrap up? Is it going to be whoops, sorry, whoopsie, sorry, and the parents don't even know? Another thing is the CDC right now is in litigation with Gilead, the maker of these HIV medications, for patent dispute. So the CDC, it doesn't surprise me they're recommending these drugs because they have patents. They want their royalties too. So we have a serious conflict of interest going on in our nation right now with the pharmaceutical industry, the pharmaceutical lobby, and the legislators of our national and state governments. And I am begging you all to please, we keep talking about the vulnerable. These kids that are uneducated and don't have parents who are there to protect them, they're the most vulnerable to be preyed upon with these drugs and medications. They don't have anyone standing up for them. They will be the first to be injected and drugged. So I'm just really tired of people saying the vulnerable, the gay population. My daughter's gay. Guess what? She's premenopausal from taking birth control for 1 year. And that was with me involved and her doctor. These drugs are not benign, no matter how frequent the use. And I wrote all of you, and I explained to you other issues of friends of mine who've had issues with pharmaceuticals. Please protect the children and do not set illegal, by the way, precedents taking away parental rights here in the state of Nevada. Thank you so much.
Please go ahead.
Hello, my name is Susan Prophet. I'm the Vice President of the Nevada Republican Club and the Nevada Legislative Action Committee. I'd like to thank this committee for your service, and I hope that you will chunk this bill. I appreciate Ms. Harris's concerns for children, but her edits appear to be a thin veil over parental rights by striking through item 1 and replacing it with a minor may give express consent. Well, that means the same thing. Until you put in there that I have the right to oversee my child's medical care, you have taken my rights away. Trying to hide it is disingenuous. Until you add that, don't even consider it. This is dividing families. I am shocked that the writer of this bill thinks conducting transgender treatments on minors is helping them, and hiding it from the parents is beneath contempt. We aren't talking about STDs alone. This bill, with its edits, will allow someone to chemically castrate children without their parents knowing. U.S. News reports that over 50% of trans and non-binary youth in this United States considered suicide this year. So they need medical help, but they need a psychiatrist. They don't need to be conditioned to change their sex when they aren't even out of puberty. And I consider it child abuse. Putting undue influence on a minor is child abuse and leaves our young people at risk for predators. Educators' jobs are to educate our children, but Nevada can't even do that right. My grandson is in Seattle, was being groomed and by someone who was gay in the school, and he thought he was gay, and we were told by his father that, you know, don't be surprised, and thankfully he didn't have anything chemically done, and he outgrew it. But, you know, he was in middle school. You're talking about taking away our rights and making major changes and letting them make major decisions about their medical care that will change the rest of their lives. This is just horrible. Right now in another room, right here,
Your colleagues are trying to make it illegal for anyone under the age of 21 to buy or own certain guns. So the fact that you now want children whose minds have not fully developed to make life-changing medical decisions without their parents' guidance is not your right, nor chemically castrating children. It's not your right. Health care is one thing, but this bill is a deliberate hijacking of parents' rights. It should be criminal to do what you intend to do with SB 172. If you're adult enough to have sex, you're adult enough to tell your guardian if you want contraceptives or if you need an STD treatment. Yes, everyone has a right to seek medical care, but even our government knows our children do not have the emotional maturity to drink and drive.
I'm going to ask you to
under
wrap
the
it up,
age of
please.
21. So, by the way, when you take the role of the parent who should, excuse me,
Yeah,
when you
please.
take the role of the parent, you should also accept the liability that comes with it for blood clots and other side effects as mentioned earlier. So thank you very much for your time.
Thank you. All right, we have one more minute that I allocated to Las Vegas in excess of our 30 minutes for opposition. I will go ahead and have you be our last opposition testimony in Las Vegas. Please go ahead. Remember to state your name for the record.
Thank you very much. My name is Julie Herford, Julieherford. I'm the co-founder of Nevadans Can. We represent thousands of concerned citizens. I want to repeat all the previously excellently made points and comments. I just want to point out the opinion records on NALA's right now for this bill is 83% in opposition, which translates to 379 citizens have sent in their opposition. Only 16% support, or only 75 citizens support this. I just wonder, why would any one of you lawmaker can vote yes against the majority of the people's will? Please respect their will and vote no on this bill. Thank you very much.
Thank you. We will move from Las Vegas to the phones. I'm going to allocate another 10 minutes potentially to the phones with the 3-minute per person limitation. BPS, would you check the phone lines for opposition and testimony on Senate Bill 172, please?
To testify in opposition to Senate Bill 172, please press star 9 now to take your place in the queue.
CYRUSHOJJATY. I will ditto the past and future comments made about this bill. I'm very glad that we are talking about this important issue. I don't really see how this builds good family structure, which I think is very important. I see also what others have said before regarding the double standards on ages, and not to mention how large pharma industries are pushing this, in addition to the side effects of the vaccines that were pushed in the last several years and decades. Thank you so much.
Thank you. Next caller, please.
Good afternoon, Chair and Committee. For the record, Jim DeGraffenreid. I'm Nevada's Republican National Committeeman on behalf of the Nevada Republican Party. We are strongly opposed to the attack on Nevada parents and families in Senate Bill 172. It was stated in the Senate hearing that Nevada law allows minors to receive birth control and treatment without parental consent. However, this is only from a limited number of Title X providers. This bill greatly expands access by explicitly allowing consent by a minor to treatment or medication by any health professional at any time. If a 9-year-old girl needs birth control, that alone should by default flag mandatory reporter calls for physicians under a clear reading of NRS 200.508, which defines abuse, and NRS 432B.220, which mandates reporting. Under this bill, however, the minor is empowered to give consent, which creates gray areas in reporting that can enable the abuse to be covered up. Rather than the victim being helped, the abuser is protected. If SB 172 is passed, which law should the doctor follow? Current abuse and reporting laws, or SB 172, which says they should look the other way when a child asks for treatments or birth control? This bill has no age minimum. It is not limited to 17-year-olds on the cusp of adulthood. This allows any minor of any age to seek medication on their own. Parents warn their children about stranger danger, and yet this bill is written to protect the strangers instead of the children. Regardless of socioeconomic status, parents care about their children and should have the final decision in medical decisions that their kids are not yet mature enough to make, not doctors and pharmacists in the pockets of big pharma exploiting vulnerable minors for profit. The government needs to stop trying to harm and replace the family unit. The government's role is to support parents' rights, not undermine them as established in Nevada statute. In 2013, the Nevada Legislature adopted NRS 126.036 to protect fundamental parent rights. This law was sponsored by Democrat Senator Mo Dennis. It passed the Senate unanimously in the Assembly on a 27-14 vote. Section 1 states the liberty interest of a parent in the care, custody, and management of the parent's child is a fundamental right. We urge this committee to follow the guidance of NRS 126.036 and vote no on this bill, which poses serious dangers to Nevada parents and families. Thank you.
Thank you. Next caller, please.
Hello, my name is Katie Banuelos, that's Banuelos. I'm calling in to represent the Libertarian Party of Nevada in strong opposition to SB 172. I'd like to start by pointing out that if passed, this bill would violate federal law, which requires that parents be provided with vaccine safety information before anything can be given to their children. So if this moves forward, you're going to see litigation along those lines. You're going to open that up. I also want to say that children are simply not capable of informed consent. Children have rights, but they're not developmentally able to execute them. It is the absolute right of parents to protect and safeguard their children until they can assume all the responsibilities of adulthood. So this bill cannot alter the fundamental nature of what it means to be a child. It doesn't confer the capacity for informed consent. It simply allows other adults to insert their judgment in place of that of parents. As many before me have noted, the drugs and treatments implied by this bill are not without risk. Many of them have serious side effects or potential harm. Everything is a matter of trade-offs and risk assessment, and it is a disservice to children and teens to pretend that they are able to navigate these concerns when they are not. The practical effect of this bill would be to dramatically expand the number of adults who are legally able to make complex medical decisions for children who aren't theirs in total secrecy without any liability or any real stake in the overall well-being of the child. And again, as others have pointed out, this includes in the schools. So your child at school, anything could be happening there without your knowledge. This bill undermines parental rights, and it also undermines the very concept of informed consent. Please do the right thing. Vote no on SB 172. Protect parents, protect children. Thank you.
Thank you. Next caller, please.
Hello, my name is Michael Ryan, Michael-Ryan. I'm a longtime resident of Nevada and a Marine Corps veteran. SB 172 removes the required parental consent or notification for any minor, girls or boys under the age of 18 to receive a contraceptive drug or device and funnels taxpayer money to provide treatment for STDs. This is not the state's responsibility. It is fundamentally the right of a parent to make medical decisions for their children. The sponsors of this bill are attacking one of their own, former Democrat Senator Mo Dennis, who passed Senate Bill 314 in 2015. Stop this insanity and do the right thing. Please protect our children and vote no on SB 172. Thank you.
Thank you. Next caller, please.
Hi, good afternoon. My name is Lorena Cardenas, Lorenacardenas. This bill creates a system to bypass parental guidance, and it is a violation of our parental rights. I know Senator Harris called it a safety buckle, but it really is creating a loophole for pedophiles. And with Nevada ranking number 2 in the human trafficking rates, I would think the legislature would want to clamp down on any loophole, and you're simply not doing that. I honestly wonder how many of those callers, there was a pedophile behind one of those calls really pushing for this bill. I wouldn't be surprised. The argument in support of it being a hurdle to force them to go out and get adult involvement, good. We need adult involvement when minors are attempting to have any type of medication that can impact their lives and their health forever. And the side effects, I mean, what about the side effects as a parent? I can't imagine. Sorry, I get emotional because I can't imagine a law that would enable minors to have medication that would impede a parent from being able to aid their own child. You're really obstructing my parental roles because you're keeping me from doing what my role is, and that's to keep my children safe. If a parent is not involved with the medication their child is taking, they can have, God forbid, the next morning you go and attempt to wake up your teen, and he can't wake up because he had an adverse reaction because he was able to by law, because of you. I mean, how do you sit there and justify yourselves and wanting to pass these bills and impeding us from being able to do our role as parents? And that's to guide our children, to keep them safe, to do our own research, and that's my job when I administer medication to my children. And for you to want to have a say in that or make it legal for them to do that without my involvement is a huge, huge violation. I really hope, again, to obtain this bill. And as the mom of 4 and teenagers, I really urge you to strike this down, whoever. Not only does it create a loophole, it leaves our children in danger. Thank you.
Thank you. Next caller, please.
Good afternoon. My name is Leslie Quinn, LESLIEQUINN. I oppose SB 172 for many reasons, including the removal of more parental rights, further destroys parental child relationship, encourages deceit between child and parent, has no age limit. If one needs to be 21 years old to drink, 23 to 25 to rent a car, depending on the vendor, 21 years old to gamble, but with SB 172, any age to take medication, experimental medication for HIV, HPV, no. If our brains aren't fully developed until 21 to 25 years of age, why would we want to allow children to make such major decisions for their health care and without their parents' supportive, loving guidance? I'm sure not many here would want a teen with raging hormones to make life-altering decisions for them. As a young mom, I was bullied by medical practitioners to give my teen daughter the HPV vaccine to avoid uterine cancer. Sadly, it sterilized her and took away her option to have children. I oppose SB 172 so all children will not have access to experimental drugs that cause life changes without proper guidance and mentorship of their parents. Why create any legislation that encourages children to engage in promiscuity? Why isn't training and abstinence promoted? Why isn't communication between a child and their parents encouraged? SB 172 promotes a heavy mental load on our children. These are our children. They don't belong to the government or any group advocating to infringe on the relationship between parents and their children. I am perplexed at the legislative push to erase humanity, emasculate men, erase women, dismember children in or out of the womb, and minimize the bond of family, all on the altar or inclusivity and of economic social governance. As a mother of 5 and 2 grandchildren, I strongly oppose SB 172 and ask my legislators, Assemblywoman Brittany Miller and Senator Marilyn Dondera-Loop, as well as all other legislators, to oppose SB 172 as well. And kudos to all Assembly legislators there or senators that support parents. Thank you, Assemblyman Gray, and all legislators that stand with parents in protecting their children. Thank you. Good afternoon.
Thank you. We have reached the 10 minutes that I obligated to the phone lines. BPS, do you have a count on how many more callers we may have?
There are 2 callers in the queue.
We'll go ahead and take those 2 callers. Again, 3 minutes apiece. Please remember to state and spell your name for the record. It may add the next caller.
Oh, not all. Hello?
Hi, please remember to state your name and spell it for the record. You may
Hello?
begin.
Yeah, my name is Charlotte Stewart with Health Freedom Nevada, and I was calling to say I agree with everything that was said before as far as opposing things. I wanted to point out that in other states that there is gender affirming care being considered as law as part of reproductive health. And that is something that will come here if this law is passed. So that's one thing. The other thing I wanted to do was point out a very dystopian possibility that your children could go to school, our children could go to school and get PrEP drugs and come home and their teeth will be falling out. They will have kidney problems. They could possibly come home from an HPV vaccine and have an adverse reaction, and the parent would have no clue. Who would be financially responsible when they are injured permanently for life? The parent. So the parent should be the one that makes the choices, not the child. The only way that this would make any sense is if the child was emancipated. Thank you, Madam Chair.
Thank you. BPS, please add the last caller to the line.
Hi, my name is Katrin Ivanov, Ivanoff, aka Mrs. Fix-It. I am from Assembly District 42, Senate District 9, and I will veto everything in opposition to the bill. I only want to add that any adult that can put together in one sentence the words minor and consent needs to be checked. There's something wrong with them. This is what we call pedophiles or predators. I don't know any normal adult that is not interested of harming kids or preying on kids to put those words together in one sentence and not be bothered by it. Regardless of what, if the person is a minor, there is a reason we call it a minor, they cannot give consent. For you to try to make it legal for a minor to give consent without parental involvement, it's very scary. We should be looking very closely at adults that are easily throwing around those words. There are several bills right now going through this Senate, through this legislature, that are aiming at minor consent, circumventing parental involvement, which is very, very bothersome to me. I apologize for the sharp tone, but this is very, very serious matter when you're trying to codify in a law for minors to be able to give any kind of consent. There is a reason we have to sign notes from school. There is a reason the school can't even give aspirin to my kids if I'm not informed. But now you want them to have all these kind of altering procedures. And what happened, I see people are pointing out just to bring the point home if there are side effects and we don't know that the kids had some kind of procedures done. Who's going to be in charge? Are you going to pay the bills? But quite frankly, I don't care who's going to be paying the bills if you damage my child for the rest of its life, and that child can no longer reproduce, and that child can no longer have a productive life, and is no longer be a productive member of society because it's turned to a vegetable because of side effects of something that I didn't even know you pushed into my child. Honestly, I was under the impression that the legislators are there to represent the people that elected them. If 80% of us are telling you, please don't vote for that law, how is that not ringing a bell? I am hoping with the move that you made and let us speak longer than the time was allowed, I really appreciate that. It doesn't happen a lot, so when it happens, thank you so much for giving us the chance to give our opinion. And I'm really hoping that you can hear us and vote no to this atrocious bill that is aiming at taking parental rights away, that is aiming of more government overreach. And thank you so much for the opportunity, because I know I wasn't allowed to speak before. I wasn't supposed to speak. You allow me to speak. I really appreciate it.
Thank you.
Thank you. And please, please vote no.
Thank you. That brings us to the end of opposition testimony on Senate Bill 172 and moves us into neutral testimony. Again, I will give 30 minutes, up to 30 minutes for neutral testimony with 3 minutes apiece. Is there anyone in Carson City who would like to provide neutral testimony on Senate Bill 172? Seeing no one in Carson City, I cannot see Las Vegas, so if you are down in Las Vegas for neutral testimony, please turn the mic on and let us know. Oh, seeing no one at the desk in Las Vegas. BPS, is there anyone on the public line for neutral testimony on Senate Bill 172?
Chair, there are no callers to testify in neutral at this time.
Thank you so much. And we had to let Senator Harris go early so that she could be in her committee. So I'm assuming she waives her closing remarks. Thank you all. We will go ahead and close out the hearing on Senate Bill 172 and move on to our last agenda item, which is public comment. Is there anyone in Carson City or Las Vegas who would like to provide public comment today? Seeing no one approaching the desks, I would go to the phone. BPS, is there anyone on the phone lines who would like to provide public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue.
Yes, my name is Leslie Quinn, LESLIEQUINN, and I would just like to say, as a parent, and in what you guys are all doing here, I'm sure that there is a lot of pressure that you all have, but it is disgusting as a parent to see the legislation throughout the United States, but especially here in Nevada, because I live here, to push erasing humanity, to push emasculating men, to push erasing women, to dismember our children in or out of the womb, and to minimize the bond of family, all on the altar of inclusivity and economic social governance. These things that you all are pushing for will affect you and your children and your friends' children. And it's going to be a sad day when you cannot reverse the motion that you're setting in place. This tsunami that's tearing apart our families will tear your family apart as well. Stand with us, stand with your constituents, and support us. Please, please continue to serve as legislators that honor the Constitution of the United States. Please, thank you so much and have a lovely day.
Thank you. BPS, are there other folks on the line for public comment?
Hi, Katrina Ivanov again, Mrs. Fixit, Assembly District 42, Senate District 9. I just wanted to ask you, what is the measurement for you guys to pass or not pass a bill if your constituents are so overwhelmingly for or against the bill and you go in an opposite direction of what constituents want, is there any repercussion of that? How is this all structured that people want one thing and at the end we send you there to on the promises that something's going to happen, and at the end it's happening totally opposite thing of what we're actually voting for. Just, I don't expect you to answer to me now, but I would like if somebody can give me some kind of an answer, because it's really devastating what I'm witnessing. Thank you so much, and I know many of you are trying your best, and some of you are trying some agendas, but thank you for the ones that are actually representing their constituents. Thank you, and have a lovely day.
BPS, is there anyone else on the public line for public comment?
Yes, so CYRUSHOJJATY. If it's okay, I'd like to respond to the questions that's made by the previous caller. The answer to that is very simple. We have a dirty campaign finance system, which means that large, wealthy donors, whether they're corporations or they fund non-governmental organizations, can fund large amounts of lobbyists and individuals who will go in and testify for certain bills, and they will donate to campaigns. And I think until that system is corrected, until we undo laws like Citizens United and so forth, which actually some elected officials in this state have talked about it, then I think a lot of things are going to change. But just going back to what two callers made about the culture, here's what I'm getting all this. There has been a lot of talk and bills about race and gender. And what I really see this is that the culture that was dominant, not just in America, but even in Western society in the early 1960s, what I'm getting is that culture, dominantly people of European descent, strong family structure, masculine men, feminine women, the middle class, that culture is really the culture that is evil, awful. It is a horrible taboo, and it needs to be completely abolished. And we have to move the furthest thing away from it. And honestly, I think the more you guys do this, the more it makes people wake up and realize that that is really something that we should aspire to, that we should preserve. And that is not likely going to make us believe that we should throw that in the dumpster. So I'm pretty grateful that we're living in these times, because it's creating a mass awakening. Thank you. I appreciate it. Yield my time.
That was at time. Perfect timing. Is there anyone else on the phone for public comment?
Chair, there are no other callers choosing to provide public comment this time.
Thank you. I went through Las Vegas, and as I was moving to the phones, I saw someone come up to the table in Las Vegas. So we will go back for public comment in Las Vegas. Please remember to state your name for the record.
I always forget. Susan Profit, Vice President of the Nevada Republican Club, and thank you for allowing me to speak again. For the Speaker of the House to say that there is no problem in our election process is a joke. There are problems, and it's unconscionable for you not to allow Governor Lombardo's voter ID bill, SB 405, to at least be heard on the floor so that we can have a vote and let the public know that he is working for us and trying to ensure that we have a voice in the next election. I am also the founder of a voter integrity group that spent every single day inside the ROV here in Clark County. And I have a lot of evidence that says the contrary to the Speaker of the House. So if he would like to give me a call, I would invite him to come to my home and see all of the evidence that we have. And I thank you for your time. Please, please bring SB 405 to the floor and at least show some respect for the governor of Nevada. Thank you and have a great day.
That wraps up public comment today. Thank you all for those who attended and participated. I will close out public comment, and folks, have a wonderful weekend. I hope you all make your flights. With that, we are adjourned.